Hi there. So we're gonna start off with we have our patient over here. His name is Ripley Clarence, as we know. So before we give any meds, I'll like to start off saying about the I would do the 3 patient checks. I would check my 6 rights, and I would compare the MAR with the medical order, and look for any allergies, any sort of that kind of stuff. And yeah, I would do that 3 times, 2 times in the med room and 1 time in the patient room. And so yeah, I just wanted to get that off first. Objective number 1. Why does he need it? Well, he needs it because according to his labs, he seems dehydrated. His bun is slightly elevated. And he has other problems, but I will mention like the potassium, magnesium, and all the other levels later on in step 5. Number 2. So for number 2, the patient's maintenance fluid is normal saline. Normal saline has a rate of 125 milliliters over hour, and yeah. For 3, we are going to be given potassium chloride with we're gonna be giving potassium chloride as a tandem. So that means that we're just going to give it with the normal saline, and we're also going to be given magnesium sulfate with normal saline as well. And so for potassium chloride, it's going to be 10 milliequivalent, and for magnesium, it will just be 2 grams through IV. So for number 4, what medications will we get as a piggyback? It would be Phenergan. So we would get Phenergan, 12.5 milligrams over 50 milliliters. And so yeah, we would give that as piggyback, and that would be infused over 15 minutes at 200 milliliters over hour. For number 5, yes, the reasons why. So we're gonna be given normal saline, as we said, because we're gonna be treating his low levels of sodium, and that's basically what that's gonna do is gonna replace the extracellular fluid replacement. So yeah, that's the reason for that. For potassium chloride, we're going to be giving that because we're going to be treating the low blood levels of potassium, which is also known as hypokalemia. And for Mr. Ripley's labs, he had low potassium. He had 3.3, and our range should be between 3.5 to 5.1. So as you can tell, his is low. Magnesium is also low as well, and so we're going to be giving that magnesium sulfate to treat the hypomagnesium. His is actually 1.6, and our range should be between 1.8 and 2.2 milligrams. Last but not least, your last medication is your Phenergan, and we're going to be giving that for the nausea, and because he's also requesting it. Let's move on into number 6. The assessment. So for the assessment, before starting IV fluids, yes. So we are going to be assessing the insertion site. We're going to make sure the fluid's transparent. We're going to check the IV insertion, see if there's any abnormalities with it. Like we would be checking for any phlebitis, any inflammation of the vein, see if we went too deep and we hit the vein, or if there was any infection. We're also going to be checking for any leaking, any redness, any pain, any swelling. So yeah, we're going to be doing that. For number 7, I believe I am. Yeah, for number 7, we're going to explain how to save flush. Yes, it's a save and flush. So for this, we're gonna make sure we clean off our, the top of the whenever the insertion is at, and so we're gonna do this in there would be intermediate. So for the saline, we're gonna have to make sure we press, and then we press like one time, wait out for a little bit, and then again. We don't wanna make sure we press all at once. And then we're gonna be doing in a pulsating motion. And so we do this because we wanna clear out the line, and we wanna remove any debris that could be in there, necessary air or anything like that. We also do this so we prevent the IV becoming blocked or anything like that, as well as removing any sort of medication that was left in the IV. For number 8, Mr. Ruby has been pulling in his IV dressing. So for number 8, we're gonna be changing the IV dressing. And so we're gonna, walk in, do our hand hygiene. We're gonna identify ourselves. We're gonna identify the patient. But one of the most important things for this is that we have to keep make sure everything's sterile, and we have to make sure when we're doing it, we have to make sure to always maintain the make sure the insertion site and then like our IV where it starts, like it doesn't move. So you have to work always around it, but make sure you don't make sure it's just rigid enough that it's not moving around. So you're not like moving around and poking the patient or anything like that. And so we can, after sterilizing the IV, we'll just moisten the edges, and then we'll make sure we can moisten that with alcohol and adhesive remover. And then if it's coming out from one side, we can work it out from there and go the whole thing while stabilizing that. And after that, we can just give it some time so it dries. And then after that, we will assess the IV, see if it's working well. And then we would put the new dressing. You can take off our gloves while we do that because that's very sticky. And then we'll just we'll make sure we can visualize the pub. And then we'll just put it on top, secure it, make sure it's well put. And make sure it's working properly, most important. So yeah, for my last one is, number 9. He's having discomfort, the IV is leaking, swelling, can touch. So for this, we would do the same steps as number 8. We're gonna be taking off, make sure it's sterile, make sure it's not moving, make sure it's stabilized. But then we will, since we're basically removing because there is some redness and pain and stuff like that there. But also real quick, I want to go back and for number 8, we also want to make sure we put the date and we put our name. That way, the next nurse comes in, and so they can check who did it and also when it was last done. So that's also very important that I forgot to mention. So we would go back to step number 9, and after we've done everything, same steps as number 8, we would do that the same thing, and then we would go. Something that we would do towards the end is that we'll make sure we have a gauze, and so we can as soon as we're removing it, and we have to make sure whenever we're removing these IVs to not touch like where the area is, because it's cross contamination and it'll just create problems. So we have to be careful with that, and then we'll make sure we use a gauze, and then we put it after that on top of it, just because some patients have diluted blood, and then they can have excessive blood coming out. So we'll just put that there for the patient, and we'll make sure we everything looks right, and we'll document. And then so we'll just document we'll document the findings, like the patient, what did he say he had discomfort, there was swelling, if there was redness, we would document redness as well. We'll document also that when we took the IV, that it was like fully in one form, nothing was like nothing was in his body and stuff like that, because we don't want none of that stuff. And wash your hands, stuff like that, check the patient, and I'll be everything.